Thank you for joining us for today's webinar, Opioid Safety, presented by the Office of Opioid Safety at the MetroHealth System in Cleveland, Ohio. My name is Marla Kaufman, and I am the Communication and Health Promotion Associate at IRETA. I'll be moderating our webinar today. I would like to go over some quick housekeeping items about how to use the WebEx technology and how to access continuing education credits. First, we would like to encourage you all to participate in today's webinar by a few different ways. If you have questions for our presenter or are experiencing any technical issues, please use the chat function to communicate your questions. Our presenters, Natalie Copeland-Traster, Libbey Pelaia, and Rebecca Mason will take questions in the middle and at the end of the webinar. Feel free to submit your questions throughout the webinar in the chat box. This webinar is approved for 1.5 PCB and/or NADAC credits, which are free. A certificate of attendance will also be available to download from your MyIRETA account. Please take note that it will take up to 48 hours for your CEUs and certificate to be available in your MyIRETA profile because we have to cross-check your attendance with the WebEx technology following the webinar. After the webinar, you will receive a few emails from us. The first will be an email which will include a link to an evaluation form for the webinar, as well as information on how to access your certificate of attendance and continuing education credits. We may send you an additional email to remind you of the evaluation. I would now like to introduce today's presenters. Natalie Copeland-Traster, MSSA, LSW, ASISC educator, earned her Master of Social Administration degree in 2018 from Case Western Reserve University, along with her license in social work. She has been a leader in the field of education for the past 18 years and is a subject matter expert in the field of mental health. Natalie is passionate about spreading awareness, advocacy, and stigma reduction through educational initiatives. Libbey Pelaia, MPH, has been an educator with the Office of Opioid Safety since 2020. She is a passionate professional leader with 16 years of experience in spearheading initiatives to improve social and economic outcomes, managing projects as well as teams, and employing process improvement as a strong community advocate. Rebecca Mason, MA, is the community manager in the Office of Opioid Safety at MetroHealth Medical Center. She received a Master of Arts degree in counseling psychology from Trinity University in Chicago and a Bachelor of Arts degree in psychology from Miami University. She is an independently licensed chemical dependency counselor with a supervisory credential and has worked in the substance use disorder field for over 35 years. Okay, Natalie, Libbey, and Rebecca, if you are ready, I will hand things over to you.
All right, thank you so much for the wonderful introductions. Again, I am Natalie Copeland-Traster, and I am one of the community educators for the Office of Opioid Safety. It really is an honor and a privilege to be here today. The mission of the Office of Opioid Safety is to promote opioid safety, not just throughout the MetroHealth system, but also in the greater community. And our office does this through education, advocacy, and treatment. Today, we will briefly review trends both nationally as well as within the greater Cleveland, Ohio region. We will also review both the internal and external Office of Opioid Safety, or OOS, programs. We will briefly discuss the grant funding as well that supports many of the Office of Opioid Safety programs. And as mentioned, we will have time for Q&A. The devastation of the opioid epidemic is prevalent. Lives have been lost, futures have been derailed, and communities have been left absolutely devastated. While hitting the economically and socially disadvantaged particularly hard, America's deadliest drug crisis has left no demographic group untouched. There are long-lasting and destructive ripple effects that are devastating to its victims and their families. We will begin by looking at the reported versus predicted overdose deaths here in the United States. As you can see, the 12-month period ending in September of 2022 is the most current data that the CDC has available. It reflects over 100,000 reported deaths and over 106,000 predicted deaths in the US. The opioid epidemic was already at a significant public health problem in the United States prior to 2020. However, the onslaught of the COVID-19 pandemic has turned the problem into an outright crisis. Like many parts of the country, Cuyahoga County, Ohio, which is where Cleveland is located, has been hit very hard by the opioid epidemic. And the chart that you see before you, it shows the overdose fatalities here in Cuyahoga County from 2011 up until 2022. It's divided by drug type that contributed to the deaths. And as you can see, there was a significant spike in 2017. And unfortunately, deaths have increased significantly since the COVID-19 pandemic began. As we know, fentanyl has been the greatest contributor to lives being lost, not just here within Cuyahoga County, but in our country as a whole. However, in response to this growing crisis, the Office of Opioid Safety was created. The Office of Opioid Safety is part of the MetroHealth system located in the greater Cleveland area in Ohio. The MetroHealth system is a 185-year-old public hospital system that has been recognized for addressing the social determinants of health while providing top quality health care. It is Cuyahoga County's safety net health system. MetroHealth operates 4 hospitals, 4 emergency departments, over 20 health centers, and 40 additional sites throughout Cuyahoga County. MetroHealth serves more than 300,000 patients, 2/3 of whom are uninsured or covered by Medicare or Medicaid. The Office of Opioid Safety team compassionately supports clients at all stages of dependency, from a harm reduction approach to early treatment for opioid use disorder. The team also provides primary prevention through prescriber training on opioid stewardship, community training to raise awareness, and we offer supports to help prevent dependency. Our office is very unique, and we are very excited to present information about our model to you today. However, before we proceed, here's our contact information. We are going to cover a lot of information today, so please feel free to reach out and we will definitely help address your needs and try to point you in the right direction. We do have additional resources available on our website as well. Let's begin by discussing the vast experience of our leadership team. Our medical director, Joan Papp, is an associate professor in the Department of Emergency Medicine at MetroHealth Medical Center. She graduated from the Medical College of Ohio in Toledo in 2000 and the MetroHealth Case Western Reserve University residency program in emergency medicine in 2004. She's also board certified in both emergency medicine or emergency and addiction medicine. She is the founder and medical director for the MetroHealth Office of Opioid Safety and Cuyahoga County Project Dawn. Dawn stands for Deaths Avoided with Naloxone. Dr. Papp is also a chairperson for both the Policy and Treatment Subcommittee for the U.S. Attorney's Office Heroin Action Plan Committee, as well as the Center for Health Affairs Opioid Hospital Consortium. Melissa Fetterman is the director of the Office of Opioid Safety here at MetroHealth. Her background is in public health planning, policy, and philanthropy. She previously led the AIDS Funding Collaborative in Cuyahoga County, Ohio. She has a master's degree in public health from Johns Hopkins Bloomberg School of Public Health in Maryland and a bachelor's degree in biology from Colby College in Maine. Melissa trained at the Maryland Department of Health and the Centers for Disease Control and Prevention in Georgia before moving here to Ohio. And Rebecca Mason, our community manager, is one of our presenters today, and you just heard her bio at the beginning of this webinar.
All right, Libby, for me to share the video, I'll need you to stop sharing your screen and then I'll share the video on my end. Okay, just a second. Oh, it's telling me that the video isn't able to be shared. I'm sorry about that. Let me try one more time. So, it's not letting me share this file. Would we possibly be able to continue and I will try to convert it to a file that's supported, and then we can pick it up at a different time? I'm sorry
Sure,
about
no
that.
problem at all. Yeah, no problem.
Libby, you'll need to share your screen again. I'm so sorry. All right, great.
All right, well, if for some reason we're unable to get that video to work, it is actually on our website as well. And our medical director, Dr. Joan Papp, she discusses the history of our office. And it's really a good video. It gives you a nice little snapshot of what our office is about. But of course, we're going to be discussing that as well. But just to make clear, since that video was produced, there have been changes to the X waiver process. Congress recently eliminated the DEA X waiver registration requirement for practitioners as part of the section 1262 to 1263 of the Consolidated Appropriations Act, which just happened in 2023. So if we do watch the video, just keep that information in mind as well. But moving on, now we are going to discuss the many programs within the Office of Opioid Safety. The education team consists of 2 community educators, as well as 1 clinical education specialist. Our team works collaboratively with internal departments at MetroHealth and in conjunction with the community at large. We provide education and advocacy regarding opioid safety and substance use disorders, or SUD, through clinical and community education programs. The OOS education team is committed to providing individualized clinical and community education. This education has been provided to MetroHealth employees, first responders, organizations within the community, employers, school districts, higher education institutions, local businesses, as well as faith-based organizations. While working with a wide variety of community stakeholders, the community education team has been able to gain an understanding of the knowledge gap that exists within Northeast Ohio. Thus, the goals for the community education team includes promoting awareness by working with surrounding communities and its stakeholders to educate on a variety of topics. These topics range from the model of opioid use disorder, or OUD, as well as the model of substance use disorder, also known as SUD, to healthy coping skills and everything in between. To support our goal of reducing stigma, our team strives to normalize the conversations surrounding both substance use disorder and mental health conditions. We provide a variety of resources during both presentations as well as resource fairs. Some of these additional resources include our Office of Opioid Safety programs and services, various local community organizations, in addition to some national resources. And our team continues to build relationships across the region, utilizing data that identifies at-risk groups so that we can implement this much needed education. One of the at-risk groups that have been identified through data includes college-age students. we have been able to foster very positive relationships with a lot of higher education institutions. These partners have indicated that this type of in-depth education, it's not typically provided to their student body nor their faculty. But as you can see on this slide, some of our higher education partners include Cleveland State University, Ursuline College, and Case Western Reserve University's School of Medicine. As with any program, barriers are to be expected. And the barriers that the community education team have encountered include stigma. As we know, there's an overall stigma regarding SUD and mental health conditions, which can create challenges in educating various audiences. Another barrier, it's the overall knowledge gap within the community, especially given all the myths and false information that exists surrounding the nature of substances. COVID-19 restrictions occurred about 1 month after Libbey and I both started in our roles as the community educators, and this created obstacles in disseminating education in person. Additionally, many of the higher education institutions, they didn't have the bandwidth to consider utilizing our resources because they had to prioritize developing policy and regulation to mitigate COVID-19 within their own institutions. And of course, community education needs and requests have been rapidly increasing, especially due to the long-term impact that COVID-19 has had on our youth. We realize that our bandwidth to accommodate these requests can be challenging due to limited staffing. So
Natalie, I think I figured out how to get that video to work. Would you like me to share it now, or do you want to wait until we get to our stopping point?
Oh, no, that's great. You can go ahead and do it now. I'm so glad it's going to work out.
I apologize for that, everyone. Okay. Now, this should work. If anybody can't hear it, though, please message and let me know. Okay.
Hello, my name is Joan Papp, and I am the medical director of our Office of Opioid Safety in MetroHealth. Our office was created to address the many facets of the opioid crisis in our community, which caused over 100,000 overdose deaths in the U.S. in 2021 alone. While our office addresses many contributing factors that lead to addiction and overdose, today I would like to focus on what we call harm reduction. Harm reduction is a concept that we can take a behavior or activity that is inherently risky and make it safer. We're not eliminating the risk, but reducing it. Some harm reduction interventions that we may already be familiar with include seatbelts to reduce the risk of injury in a car crash, or condoms to reduce the risk of HIV transmission. Drug use is obviously a very risky behavior. Some of those risks include non-fatal and fatal overdoses, acute infections of skin, soft tissue, bone and heart valves, and the transmission of chronic infections like HIV or hepatitis C. In the Office of Opioid Safety, we offer 3 main evidence-based interventions that can reduce these risks: take-home naloxone, fentanyl test strips, and syringe exchange. Number 1, take-home naloxone. This is the opioid antidote that reverses the respiratory sedation caused by opioids. We provide this to people who use drugs and to people who may be in a position to rescue them, like family, friends, and treatment professionals. We also offer education on safer drug use practices, making sure you're not using drugs alone, avoiding combinations of opioids and other sedatives, and testing your drugs for illicit fentanyl. Number 2, fentanyl test strips. These are easy-to-use drug testing strips that allow a person to check their drug supply for the presence of fentanyl. Fentanyl is a common adulterant that may be present in other drugs like cocaine and the fake pills commonly sold as Percocet or Adderall. We recommend that anyone who uses illegal drugs or pills, not just opioids, test the drug to ensure that they know what they are taking to prevent a fatal overdose. Number 3, syringe exchange program. This provides clean needles to people who inject drugs in exchange for used needles. This practice reduces the risk of transmission of HIV and hepatitis C among drug users and can reduce acute infections of other organs in the body. This intervention is supported by the CDC and has been shown to reduce the risk of HIV transmission by 80% among people who inject drugs. It also reduces the risk of needle sticks for people in our community by removing dirty needles that are improperly disposed of. We offer our harm reduction services in a variety of settings throughout MetroHealth. We have nalox boxes for community access naloxone if a person witnesses an overdose on the MetroHealth campus, and throughout the community in high-risk areas. As a MetroHealth employee, you can obtain a free naloxone kit by stopping into the MetroHealth Police Department and requesting one. If you are a community member who is at risk or in a position to rescue a person who uses drugs, you can stop by our harm reduction mobile RV unit, located at 3370 West 25th Street, directly across from the Outpatient Plaza building. It's open Monday through Friday from 10 a.m. till 3 p.m. This location offers HIV and hepatitis C testing and referrals to addiction treatment services. Thank you for taking the time today to learn more about harm reduction at MetroHealth. For more information, visit metrohealth.org/Office of Opioid Safety.
Okay, so as we previously mentioned, the education team also provides clinical education. And the goal of clinical education specialist is to bridge that gap between our clinical teams and the resources of the Office of Opioid Safety. Meeting with frontline staff, both MetroHealth and outside agencies, allows for their valuable input, which helps in identifying educational needs, barriers, and areas for improvement. The Cuyahoga County Correctional Center and all the MetroHealth emergency departments are the top priority when it comes to educating clinical staff. Both entities provide 24/7 front door access to patients with SUD needs, many in acute crisis. Working in these two specific settings can be quite challenging. Therefore, providing staff with the necessary resources for patients will help improve outcomes, enrollment in treatment, and ultimately save lives. It is imperative that the staff receive additional training. However, it can be challenging in scheduling adequate time due to other hospital priorities. So on this slide, you can see that these are only a few of the many initiatives that our clinical education specialist is spearheading. She's working on onboarding of new nurses with the ED, the Cuyahoga County Correction Center, as well as nurse residents. Improving the recognition of the relationship between human trafficking and SUD. Our clinical education specialist is currently collaborating with our sexual assault nurse examiners in order to address this. Recognizing substance misuse among healthcare staff and identifying signs and symptoms in others. She's also collaborating with many community agencies. And now Libbey will go ahead and discuss our controlled substance peer review team.
All right, thank you so much, Natalie. And yes, now I will go ahead and talk to you about our Controlled Substance Peer Review Team, also known as CSPR. Our CSPR team is a multidisciplinary team that applies standards for the safe prescribing of controlled substances all throughout the MetroHealth system. The team consists of our specialty pharmacists, our nurse case manager, our utilization review nurse, and our business analyst. The review of prescribing practices allows for feedback as well as recommendations for improvement in a confidential and collegial environment for providers. The end goal of this is to reduce adverse patient outcomes as well as the number of prescriptions for controlled substances. Using data analysis from our opioid dashboards within Epic, which is our electronic health record system, the CSPR group works to help providers become more aware of their prescribing habits through chart review and report cards. The CSPR team works in collaboration with the provider education team. The collaboration between these groups allows them to determine specific needs for the providers and the education that they may need. The peer review committee is focused on identifying high prescribers of controlled substances, as well as patients that might have an opportunity to decrease opioid usage or even explore alternative treatments. These educational meetings provide assistance, such as those that you see listed on this slide, which include the opportunity for prescribers to review their own prescribing patterns compared to others within their specialty, as well as just an overall reduction in the number of prescriptions for controlled substances. The data here illustrated on this graph really does speak for itself. The implementation of peer review, as well as the annual report cards, have really helped providers to become aware of their prescribing habits. Through this process, they have continued to significantly decrease the total opioid pills prescribed to patients. The data reflects that quantities of pills are being reduced. However, this does not necessarily reflect that the number of prescriptions have decreased in the same way. The team really looks very closely at both the number of pills and prescriptions dispensed, with the overall goal of prescribing less opioids to patients. CSPR has also been monitoring the co-prescribing habits of opioids with active benzodiazepines. Evidence-based research indicates a significantly high risk of overdose when these medications are taken together, and this particular topic has recently been brought into the spotlight within the addiction medicine field. Both medications are highly addictive and cause respiratory depression, and additionally, there is a high risk of death with the occurrence of withdrawal from benzodiazepines. Our pharmacy specialist and nurse care manager have built a team within the CSPR group, and the collaboration works closely together on a variety of projects, a couple of which we're going to review with you today. Our pharmacy specialist provides e-consults that can be requested by any provider in our system that might have questions about pain management or medication related to pain management. She also conducts pharmacy pain medicine evaluations, which can be requested by any provider. This evaluation provides recommendations regarding pain management treatment plans, as well as medication reconciliation. She is a member of the Controlled Substance Peer Review Committee that we previously discussed, and she also works with the Pharmacy Residency Program Directors to ensure success of the residency program. She is a preceptor to pharmacy students and residents during their clinical learning experiences. Our nurse case manager is also a member of our CSPR team. She works individually with patients and educates on the high risks of opioid use and opioid benzodiazepine combinations. She coordinates patients' transition to care for specialty services. Many patients on her caseload are struggling with severe chronic pain, so developing an individualized approach to their plan of care is imperative. This graph here shows encounters with our specialty pharmacist services. The process begins with consulting the pharmacist for recommendations to manage medications. Then the nurse case manager will contact the patient to provide education and to schedule an appointment with the pharmacist. Next, the pharmacist meets with the patient to reconcile medications, provide additional education, and to send recommendations to the referring provider. The nurse case manager then follows up with the provider and the patient as needed. E-consults can also be requested for specific medication questions from the provider. Looking at our palliative care collaboration project, the process here is as follows. So the provider might request assistance with legacy patients that are prescribed high doses of chronic opioids. We see that a majority of those patients did not meet criteria for palliative care, and they were more appropriate for chronic pain treatment. Due to high doses and combinations of medications, they were at increased risk for adverse outcomes. So the team worked collaboratively with providers to develop plans of care for individual patients. The overall goal is to optimize medication regimen, provide referral to appropriate specialty, and case management follow-up. With this population, overall, there was a decrease in opioid and benzodiazepine co-prescribing, and in addition, there was an increase in naloxone prescriptions. Some barriers identified for this team include a lack of insurance coverage and the need for prior authorizations, difficulty coordinating care between specialty departments, and challenges in contacting patients, a patient's lack of readiness to change, transportation challenges, and a lack of education regarding risks. And now we'll cover our academic detailing team. We also call our AD team. Our AD team consists of our academic detailer, who is a registered pharmacist, and our program coordinator for Office of Opioid Safety Strategies. So what is academic detailing? At its heart, it is a 15 to 20-minute education session. It is direct outreach to clinicians with all of the latest clinical information, resources, and MetroHealth system policies about opioids and related topics. Each session is tailored to the specific needs of the clinician and their specialty. The overall goal of academic detailing is to improve self-efficacy and change behavior for improved patient care as it pertains to opioid management, as well as medications for opioid use disorder, otherwise known as MOUD, here at MetroHealth. Our AD team has met with over 320 providers within the MetroHealth system. As you can see, they met with an array of providers from various specialties. Our academic detailer reviews prescription drug monitoring programs, EHR tools, laws, guidelines, and other topics related to opioid safety. Prescribing behaviors have indicated that following the academic detailing session, there has been a decrease in the number of opioid pills prescribed, along with the number of opioid prescriptions. The amount of co-prescribing opioids and benzodiazepines have decreased. However, the number of referrals to pain management have increased. So it has been a very successful program. Initially, it was challenging to try to identify providers and find appropriate ways to reach them. It was also difficult to schedule these sessions with providers to ensure that it did not interfere with any kind of patient care. But however, our coordinator joined the team, and once she did, her in-depth knowledge of the MetroHealth system eliminated this barrier and helped to facilitate the success of the program. Here are the different initiatives that the academic detailing team will be embarking on soon. They want to increase access of care for our SUD patients in both the emergency department as well as within primary care. Now we're going to tell you about our Motivation and Engagement Clinic, or as we like to call it, MEC. This clinic really is very unique, and there is no other model like it in the country. But before we proceed in talking about the MEC, we want to talk about medications used in opioid use disorder, or MOUD. You've heard us mention this a couple of times already in the presentation. It's also commonly known as medication-assisted treatment, or MAT. These are FDA-approved medications that block the effects of opioids and relieve the withdrawal symptoms and cravings that can occur when someone stops using an opioid. These medications are used with other behavioral health services and are not meant to be a standalone treatment. MOUD is not substituting one addiction for another. This popular misconception is not grounded in science. MOUD is along the same lines of treatment as someone who might need to save their life from a condition like insulin-dependent diabetes. This misconception can exist among healthcare providers themselves and impact their ability to care for this patient population. The Motivation and Engagement Clinic provides patients with opioid use disorder access to low-threshold care. Patients enrolled in the MEC have access to medication-assisted treatment, level of care assessments, case management services, group and individual counseling, peer support services, and care coordination. Any patient may access this walk-in clinic without a referral, including patients who have already been evaluated by other MetroHealth providers. The MEC is currently open from 11 a.m. to 2 p.m. every Tuesday and Thursday, and again, no appointment is necessary. The goals of the MEC are to increase access to MOUD for our patients. The medications used in this clinic are buprenorphine and Sublocade. We also want to increase total referrals to MEC by informing our primary care, emergency department, and inpatient units. We like to expand our clinic hours to increase access to MOUD and psychosocial behavioral health services for people with OUD. We want to increase engagement with people who have OUD, increase awareness of MEC and other addiction services throughout the MetroHealth system, the community, and beyond. And our main goal is to reduce non-fatal and fatal overdose rates through increased distribution of naloxone and fentanyl test strips. The MEC opened in July of 2021. In the short time of July to December, there were 241 new patients. The initial goal was to see 100 unique patients within the first year. As you can see, that goal was surpassed within the first 6 months. In total, there were almost 2,000 visits during that time. It's also important to note these numbers do not reflect the referrals that have been received through family, friends, or online. And as you can see on this graph, the number of new patients doubled and total visits more than tripled during 2022. And again, these numbers don't reflect the referrals that have been received through family, friends, or online. This data really just reflects the great need that exists within our community. Some of the barriers the MEC are currently experiencing include recruiting Spanish-speaking providers and Spanish-speaking group therapy facilitators for our Spanish-speaking patients, as well as to staff employees outside of the Office of Opioid Safety. And Marla, I believe we said that this might be a good halfway point for some Q&A.
Sure. So it doesn't look like we currently have any questions. If anybody has any questions that have come up so far, if you want to get them in the chat box right now. All right, it doesn't seem like any are coming in, so we could just continue and then take any questions that people might have at the end.
Okay, great. The next slide was actually that short video, so I went ahead and
Okay.
stopped sharing.
Great. Let me just pull this up.
Public health is about meeting people where they are. When COVID-19 hit Northeast Ohio, doors closed everywhere. And on the long list of closings were the places where people with substance use disorders go to get help. But they weren't forgotten. The staff of MetroHealth's Office of Opioid Safety quickly pivoted to reopen those doors. We didn't ask people to come to our office where others might be sick. Instead, we parked an RV across the street from our main hospital in Cleveland to pass out Narcan kits, fentanyl test strips, and other life-saving treatments. And when the pandemic forced another local health organization to shut down its needle exchange program, we opened one up and have exchanged nearly 6,000 used syringes for clean ones in our first month. And if someone is ready for treatment, we do that too. We have an addiction provider to do an assessment, start medications, and coordinate ongoing care. And these services are needed now more than ever, as our county jail has released hundreds of people to stop the spread of the virus, many of whom were battling addiction. We take care of everyone, wherever they are. It doesn't matter how much money they have, if their wallet holds an insurance card or not, or if they're struggling with addiction. Public hospitals, we're one more way that public health matters.
Oh, just a second. Okay, sorry about that.
All right,
We
great.
did have a few questions that did come in while
Okay,
the video
great.
was going. So is it okay if we go with those now?
Sure.
Okay. So one person asked, do you know of any other counties that have this care system in place?
So as far as we understand, we know that our model is fairly unique, and we know that other systems might have some pieces and parts, but as far as the full model integrated and is so multifaceted and comprehensive, we're not sure that anything that extensive really exists in any of the other counties within Ohio, and as well as outside of Ohio. Not that I'm personally aware of.
Okay, thanks for that.
Mhm.
Another one that came in from Elaine is, what is the age range of visiting patients?
Do you mean for the mech?
I think so, yeah.
Okay. As far as mech, I believe the age range is pretty open. I believe they've seen patients as young as maybe 2021 and up to in their 70s. It's a wide range of a patient population that attends the clinic.
And then from Abby, what has the provider response been to the academic detailing?
Yeah, that's a good question. I believe overall fairly positive. You know, I think especially now, given all the information that we have, and all of the lawsuits that we've seen in the news with Purdue Pharma, and kind of having a great understanding of where we are as a society and how we got here due to opioid prescriptions and how our mindset and how they were being prescribed for so long. And now we know how harmful they are. So I think overall the response has been fairly positive because of that understanding that we now have collectively of like, taking some responsibility for why we're here at the opioid epidemic where we are with how it began with opioid prescribing.
And just to piggyback on that, providers, it doesn't matter what specialty you're in, chances are likely you're going to encounter patients that are struggling, with SUD and OUD. So being able to, have that additional, again, very individualized, tailored education to help meet their needs has been, very helpful. And our ED team has indicated that it really has been overall a very positive response.
Mhm.
They're not approaching by being like, oh, you're prescribing, too much and you need to change now. They're having a dialogue, a conversation, and just seeing what can we do to help support you. Let us educate you with what we know, especially having, that registered pharmacist as part of the conversation. So it's been a really, really great program. And again, it's something that they're going to, continue to do throughout our system.
Then from Abby, what has the provider response been to academic detailing? Or did I just ask that
Oh,
one?
yeah, that's
Yeah,
what
I
we
just
just
asked
covered.
that one. Okay. From Jan, what is the funding stream for MET clients and do these present any barriers?
So funding for our MEC, I believe we're going to be covering funding towards the end of this presentation.
Okay,
So
we can wait
well,
till.
yeah, we'll be covering that. We're not gonna get too into the weeds with it, but we do want to outline how all these different programs are funded. So we'll be covering that towards the end.
Oh, great. And then no more questions, but just two comments. Michael said, this is great information and will definitely allow us to help many people. Thank you. And Sharon said, Tennessee is just starting the process of test strips to users. Wonder if you could send more information on your program.
Oh,
Um,
wonderful.
but so I believe there's a link included in the slides. So, and then I think you might have your contact information where Sharon could reach out to you for more information.
Absolutely. We have a direct email address, so please feel free to email us. Marla will be sending the slide deck to all the attendees and definitely reach out and we'll be happy to make that connection.
Great.
And towards the end of the presentation, we will have the slide with our contact information again as well. If you want to reach out to us before you receive the slide. So there's that option too.
Awesome. All right.
Great. All right, so I will go ahead and start resharing so we can move on. Let's go ahead and share. All right. And now I'm actually going to be passing it over to Becky Mason, and she's going to talk to you about our Project Dawn and Syringe Exchange mobile unit.
Okay, thank you, Libby. Good afternoon, everyone, and thanks again for joining us. My name is Rebecca or Becky Mason. I'm the community manager and oversee many of the Project Dawn and Syringe Exchange program services. So now we're going to kind of shift the focus to the office's external programs. Just as a side note, by the way, MetroHealth's Project Dawn program was one of the first programs and actually is celebrating its 10th year anniversary this year. And as you heard from Dr. Papp, was kind of just the beginning of the hospital's efforts to address the growing opioid problem. The overall goals of our Project Dawn program are to provide naloxone to persons who are at high risk for opioid overdose, also to the community at large, and to frontline safety personnel to reduce the number of fatal opioid overdoses in Cuyahoga County. Over the past 10 years, Project Dawn has partnered with local agencies and law enforcement entities, including Cuyahoga County Corrections Center, also known as the jail, the quick response teams, Cleveland EMS, Cleveland Public Health Department, and the Cuyahoga County Board of Health. The MetroHealth system has also adopted Project Dawn within a variety of its own programs and services, such as the Emergency Department, the Infectious Disease Department, and Behavioral Health Services. Additionally, as a function of the Syringe Service Program or Syringe Exchange Program, another goal is to provide harm reduction supplies primarily to people who inject drugs, such as sterile syringes, safe injection kits, wound care items, fentanyl test strips, and condoms. This helps to reduce the acquisition and transmission of infectious diseases such as HIV and hepatitis C, and of course also infections such as endocarditis. We can also provide connections to immediate medical care, substance use treatment, and mental health treatment. So this is about increasing the safety to those who are still using substances and therefore also protecting the greater community. So here are some things to expect when visiting a Project Dawn site in Cuyahoga County. Anybody interested in receiving naloxone can be seen without an appointment. This visit is confidential, but it is not anonymous. We do have a requirement for data on some level. After a brief educational session on how to use naloxone, anyone can leave with a Project Dawn kit. The kits include 2 4-milligram intranasal doses of naloxone, along with other life-saving essential tools. This is quick, easily accessible, and again, potentially life-saving. This is a naloxone kit distribution graph, and this gives the 10-year view of how this program has grown over time. The chart represents the total number of naloxone kits distributed at all Office of Opioid Safety Project Dawn distribution sites, not just the mobile unit, within our county. And it's in comparison to the number of known overdose reversals, which are self-reported during each respective year through February of this year. So as you can see, it's a significant increase in the naloxone that is being distributed to the community in the past 10 years. Unfortunately, due to the nature of reporting overdose reversals, which is a specific question that is asked to anyone who receives a kit, the number of actual reversals is likely underreported. So that is, again, it's kind of an overview of the past 10 years. We've gone from a little over 300 kits to over 7,000 kits last year. So as Dr. Papp has already discussed, the primary hub of services for Project Dawn is the expanded mobile unit. And since the second video, we have a new unit, you can sort of see in some of the pictures, which is a modified 30-foot step van on the MetroHealth property, which provides the services listed on this slide, as well as Medicaid enrollment assistance, linkage to treatment for substance use disorder, post-incarceration services, and other case management assistance. The expanded mobile unit continues to fill a service gap for a very vulnerable community, especially those recently released from the jail before they can possibly complete their discharge plans. The specialized mobile unit allows for greater access to naloxone and other harm reduction services due to its ability to travel within Cuyahoga County. We have a collaboration with the Hunger Network of Cleveland, which allows for weekly delivery of healthy food for our participants. And we also have clothing and other like hygiene items and such available to them as well. Most importantly, the staff approaches this work very passionately and with a non-judgmental and compassionate approach, which results in long-lasting and trusting relationships between the staff and the participants. This increases the likelihood of successful linkage to treatment and or medical services when the participants are ready. Here's some additional data from 2022. As Dr. Papp discussed, we added the syringe program to the Project On program in 2020. So this slide represents the number of syringes distributed and the number of mobile unit encounters last year. So as you can see, almost 400,000 new syringes distributed to our participants and 9,000 encounters. Those are not unique encounters, by the way. Those are repeated, many of them. Fentanyl test strips were an important addition to the harm reduction services, as much of the drug supply, as you all know, has become contaminated with fentanyl. And the total number of fentanyl test strips represents all test strips distributed to all venues. And you can see the new vehicle there up in the right-hand corner. Another data piece for you. Here are some additional points for 2022, including the number of naloxone kits distributed from the mobile unit alone, and the importance of community engagement. As discussed previously, on the mobile unit alone, Project Dawn has distributed 2,400 fentanyl test strips, and participants report adjusting their drug use to use less of a drug or substance, or not using it at all. And I believe that was an 86% positive rate of change. That is a specific question that is asked when we distribute fentanyl test strips, by the way. Other achievements for 2022 are listed here, including hosting an overdose awareness day for both the community and for MetroHealth staff members, which was well received. Okay, we're going to talk a little bit about some new initiatives in the past year or so. One is a collaboration with the Cuyahoga County Addiction and Mental Health Services Board, which is a naloxone emergency cabinet program. The naloxone emergency cabinet is a metal or plastic box permanently affixed to a wall that stores our naloxone. It also contains a face shield, a QR code, and written instructions for administration, and along with treatment referral information. It's kind of like an AED machine that you would find in public places and allows the public easy access to Narcan during an opioid overdose emergency. Many of the cabinets have 24/7 availability as well, depending on the location. These cabinets are installed in various public and private areas where data reflects a high number of opioid overdoses, along with high volume public venues, such as the Rock and Roll Hall of Fame. Also, if you're traveling through Ohio, little side note, all of these service plazas along the Ohio Turnpike also have these emergency cabinets within them just recently. These units are easily accessible, positioned in highly visible areas. We are contracted with the Adams Board to install, stock, and monitor the use of these cabinets with additional oversight from the State of Ohio Pharmacy Board. It is important to note that Ohio law contains a Good Samaritan clause that protects someone who gives naloxone to an overdosing person and calls 911. Some of the issues regarding installation of the boxes revolves around liability, and as you can imagine, and also stigma. We currently have installed 145 boxes within Cuyahoga County, and we have around 450 more boxes yet to install. Many schools, treatment centers, restaurants, bars, Cleveland public housing units are slated to receive an emergency cabinet. And that comes with staff training as well, which is really important to have a responsible person on that location. This is a brand new initiative within the past 3 months, actually. The MetroHealth Medical Center is one of 5 Cleveland locations where a vending machine stocked with naloxone has been installed for public use. That is literally it right there in the picture. And it is situated near the emergency department and is available 24/7 with operational instructions included on the machine. It is accessed through a QR code that's provided. This provides access to free Narcan or Cloxato, which is a higher dose of naloxone. And the vending machine also includes other harm reduction items such as condoms, wound care kits, fentanyl test strips, and sharps containers, which are only available to registered participants of the syringe service program. So that is a little bit different. There are no syringes in the machine, just in case anybody was thinking that. So since the beginning of December of 2022, the machine has already dispensed over 120 naloxone kits. Barriers. So when implementing cutting-edge harm reduction initiatives, you can expect that there will be some barriers. Some of the barriers Project Dawn has encountered includes stigma surrounding the use of harm reduction interventions in general, along with the typical stigma for people who use substances as well. A second barrier was finding immediate linkage to MOUD or MAT for participants interested in seeking treatment. And the key word is immediate. The MEC walk-in Suboxone clinic has helped to break down this barrier, however, as we saw the numbers for that. Also, finding appropriate locations for services in the community. Unlike the popsicle man, we cannot just get into the vehicle and drive somewhere and set up. There is a lot of planning and communication that is required for that. Finally, securing adequate funding is important, particularly when it comes to purchasing sterile syringes. One other thing to note, there was recently a change in Ohio in the law happening in Ohio on April 6th, which will deregulate the distribution of naloxone. So that will be a burden lifted from those of us in Ohio. And finally, please support your local syringe service program. Most of the programs require a local board of health approval and a lot of buy-in from local law enforcement and community stakeholders. So if you're unsure about where to locate your local syringe service program, contact your Board of Health and they should be able to direct you. If you're in Ohio, Harm Reduction Ohio is a great website for additional information and program sites. And finally, the CDC provides education, support, and guidance documents, which are accessible through their website. So thank you for listening. And with that, I will pass this back to Libbey.
All right, great. Thanks so much, Becky. And now we're just quickly going to cover our quick response team. We also call it our QRT. Our QRT has a licensed professional counselor who, along with law enforcement, attempts to interact face-to-face with overdose survivors. They do this by going to the home and engaging with the survivor and or their family, provide resources for treatment as well as harm reduction, distribute Narcan and fentanyl test strips, and provide information and resources to address any other social determinant of health that may exist. The team is responsible for 4 quick response teams that currently operate within Cuyahoga County. The first is the Cuyahoga County Sheriff's Department. They also collaborate with Parma Police Department, West Shore Enforcement Bureau, which is made up of officers from some of the suburbs here of Cleveland, which include Bay Village, Fairview Park, North Olmsted, Rocky River, and Westlake, as well as Euclid Police Department. As you can see in the bar graph on the left, our QRT was able to provide outreach to almost 1,000 individuals in 2022. 25% of those individuals were contacts made with the survivor and or their family, and resources were provided to almost 800 individuals. The pie chart on the right shows outreach based on the partnering department. The Cuyahoga County Sheriff's Office accounts for the majority of people that we are able to reach, which was about 717 individuals. Parma accounted for 88, Euclid 17, and the West Shore Enforcement Bureau accounted for 9. The QRT partnership was a major milestone for MetroHealth's Office of Opioid Safety, as well as the Sheriff's Office and for the county as a whole. It allowed overdose outreach efforts to expand into the Cleveland zip codes where the data reflected the highest rates of overdoses. MetroHealth's QRT is completely unique in the state of Ohio because it is the only hospital-driven organization that is operating quick response teams for overdose outreach. In 2022, our QRT became part of the statewide Ohio Quick Response Team and Ohio QRT Deflection and Pre-Arrest Diversion Association program, recognized as leaders in best practice. Over the last year, the team has successfully placed 33 QRT clients into our Motivation and Engagement Clinic. And in April of 2022, MetroHealth was selected to represent the state of Ohio quick response teams at the National Opioid Conference in Atlanta, Georgia. The team was able to highlight the expansion and best practices since operations began in 2018. QRT has had barriers in making face-to-face contact with survivors. This can be due to addresses not being correct, as well as some other factors. In addition, it has been challenging in tracking the long-term treatment outcomes of survivors. This can be attributed due to HIPAA laws, a transient population, and challenges in having updated current demographic information. The future goals of our QRT start with adding an additional day each week with the Cuyahoga County Sheriff's Office. The team would also like to begin both a 90-day and 6-month follow-up visit with survivors. QRT would also like to work towards being able to keep clients within the MetroHealth system. This would facilitate continuity of care through referrals, as well as transitional care to the Motivation and Engagement Clinic. And now I will pass it back over to Natalie, and she's going to tell you about our exam program.
All right, thanks, Libbey. So the Expanding Access to Medication-Assisted Treatment, or exam team, consists of our APN provider, MAT supervisor, MATRN, senior addiction specialist, and exam coordinator. So the exam program works out of the Cuyahoga County Corrections Center to expand treatment for patients that have been identified with OUD. The exam team assesses patients with OUD to determine their level of need, and they participate in an alternative to incarceration program pretrial with our local drug court. The goal of the exam program is to reduce both mortality and recidivism while increasing patient engagement. They provide medication-assisted treatment with buprenorphine or naltrexone while clients are incarcerated. The exam team also supports patients while in treatment by assessing patients with OUD to determine the appropriate level of care that's needed, as well as facilitating behavioral and support groups. And upon release, they connect patients to MetroHealth outpatient treatment providers to continue on with MAT and intensive outpatient services. They also are provided with a Project Dawn kit. But what sets our exam program apart from other programs within the jail is that the exam team connects clients with services once they leave the jail. The exam team also maintains a supportive relationship with clients beyond the length of incarceration and throughout their treatment and recovery journey. As we know, once inmates are released, recovery support is especially needed. And some of the ways that the exam program assists patients in the community following their release is by connecting them to peer support. They also work to ensure that transportation is provided both to and from their MAT or IOP appointments. And resources are also provided to help support their recovery as well as reentry into the community. So the pie chart that you see on the left provides information about the patient population of the exam program. As you can see, 3/4 of the population are male, and the majority of patients identify as white Caucasian. So this graph demonstrates the treatment referral and follow-up care for over 450 exam clients from 2021 to 2022. Overall, 42% were sent to continued treatment, and there is a large number that are not in treatment and not currently incarcerated. But it is important to note that this number may actually be higher because sometimes it's really difficult to track clients that have been released due to not receiving that information in time. And some of the barriers that the exam team have experienced includes tracking clients upon release. Also, it can be really difficult to schedule meetings due to lockdowns, having to do inmate counts that are required by both correction officers as well as the sheriffs. Also, receiving notifications about clients' release and or their release dates. This was especially challenging during the beginning of the COVID-19 because there were mass releases going on in order to try to mitigate the spread of COVID-19. Also, having that accurate contact information for clients once they're released. And sometimes there can be challenges in communication, especially between specialty docket courts, providers, etc. A good example of this is ensuring that medications do not get missed when a client is actually being released from the jail. And a common theme, stigma, that we know exists. It can exist from clients where they're experiencing self-stigma. We know that there's stigma within the system as well as within society. So obviously we had one of the questions, how do we fund all of these programs and initiatives? Well, a lot of them come through grant support. So again, we're not going to dive in too deep, so we're just going to briefly review some of these funding sources. The Overdose to Action Grant, or OD2A for short, that supports all of our external outreach as well as many of the internal initiatives. The Bureau of Justice Assistance's Comprehensive Opioid Stimulant and Substance Abuse Program, COSAP for short, funds our QRT as well as Project Dawn. The State Opioid and Stimulant Response Grant, or SOS, funds our exam program. And our Project Dawn team additionally receives funds from the National Institute of Health Healing Community Study, the Ending the HIV Epidemic Grant, and through our local Adams board. And of course, we are supported by the MetroHealth system as well. So again, here is our contact information. I also did put some of this in the chat. We realized that we covered a lot of information today. So if you're interested in getting more information, please don't hesitate to reach out to our office. You can call us, you can email us at opioidsafety@metrohealth.org. If you have any questions about, pertaining to the education, we can be reached at educationoos@metrohealth.org. But of course, please visit our website. We have additional resources as well as more information about our various teams. And finally, we do want to make mention of our award-winning podcast, One Path. It is available via any streaming platform. That does include Spotify as well as Apple Podcasts. And One Path is a MetroHealth podcast, and it addresses all the facets of the opioid epidemic. But additionally, it discussed ways that MetroHealth is leading the way in mitigating this crisis. All right, and now we will go ahead and open up for questions. I know that there was a question about how MEC is funded. MEC is not grant funded. So, you know, a lot of our patients, as we mentioned earlier, are on Medicaid or Medicare. So that's often how, you know, how they're billed and whatnot. And I think Becky might be able to add on to that.
Yeah, just a little bit. They originally the MEC patients were not billed for, so they needed to, within the hospital system, build a way of being able to bill that in order to make it more sustainable. And obviously, MetroHealth is a county safety net hospital, so they really don't turn anyone away, which is obviously very helpful. So the majority of the patients are billed through whatever funding source that they have available.
Thank you so much. That was such an interesting presentation. We do have a few more questions. A lot of people are just interested in sustained funding and sustainability. So somebody asked if you had a sustainability plan that you might be able to talk about a little bit.
Ladies? I am aware that our director diligently, as does our medical director, as does the hospital, scour for new grants and new opportunities. We just applied for another grant recently. Again, we do have support through our behavioral health department at the hospital and other departments as well. But for the most part, it's a journey, and that is a never-ending quest, particularly for certain types of items, like I mentioned, when it comes to harm reduction. So I believe that some of the stipulations for harm reduction supplies will be a little easier to get down the road if I'm reading the national drug policy correctly. So that might be a change to come.
Awesome. Let's see. We're getting a lot more that came in. Someone said, Giselle said, super comprehensive program. How long has the program been in existence? Which I think I might have missed when you were talking about. Were different facets added over time? And if so, which would you recommend you begin with first?
Well, so the Project Dawn program started back in, was that 2013?
Yes.
And then the Office of Opioid Safety officially opened in 2017. As we had, you know, so Project Dawn was obviously still operating at that point, but slowly over time, we started adding more and more and more initiatives. QRT, as we mentioned, began in 2018. The exam program, I believe, was 2017, 2018. The community education team, we literally started the first week of February of 2020, and we know that COVID started 30 days later. You know, again, you know, some of these other programs we've just been building up over time. The Motivation Engagement Clinic, that was last July, so it's about to, you know, celebrate, you know, 1 year. And obviously, based on, you know, the data that Libbey was showing you, it's just been expanding. So as far as, you know, recommending where to begin first, honestly, I think it would really sort of depend on, you know, do you want to start with a harm reduction approach, or are you looking more into treatment? It kind of depends on what sort of school of thought, you know, that you subscribe to. And again, one thing that we have realized through, you know, this opioid crisis is that, you know, one size does not fit all for the recovery journey. You know, as you know, Becky had discussed, our Project Dawn team, they truly capture the spirit and essence of harm reduction, meeting people where they are at in their journey, and having, most importantly, that non-judgmental approach. Again, you know, our QRT is unique where we understand that there is that small window of time, especially following a non-fatal, you know, overdose, where, you know, you might want to try to, you know, intervene and offer, are you ready for treatment? And if not, okay, well, here's some harm reduction. Here is a Project Dawn kit with Narcan. Here are resources for when you are ready. So, you know, really just trying to, you know, take it from a holistic and well-rounded approach. has been what has helped our office continue to expand. And the data suggests that having this approach has been, effective.
Right.
Let's see. Sorry, I just had one other one pulled up. This is an interesting one. Bonnie asked if your county, if your county showed a decline in overdoses since the program inception, or I guess I just want to add, is there any way you're able to track the success of your program, or is that hard because of some of the things you were talking about earlier as far as transient communities and everything like that?
Again, we were just trying to do sort of an overview, and we don't have specific data at our
Mhm.
fingertips, unfortunately. But I think my perception, in just looking at the medical examiner's reports in our own county, there's been somewhat of a plateau, but it's not really diminishing. I mean, I believe that our efforts are definitely helping. There's no doubt about that. We have a lot of data that we collect. We have a lot of data that we report on in various places that analyze that data. So to have that available right this minute, I do not, but we could certainly provide that.
Oh, that's okay. I think
yeah,
just it was an interesting question to ask.
sure.
And then
No,
we're just
that's why we're here. So
yeah.
that's the point.
Well, and also another thing to take into consideration is that since the Office of Opioid Safety opened, there have been a lot of variables. Fentanyl contaminating the drug supply. You're also having additional things being added, such as xylazine and some of its analogs. There was also issues with carfentanil for quite some time, and then we have COVID, which is just, you can see it nationally and it's reflected locally that that things are changing. And it's not even so much that drug use is more common as much as it is much more dangerous, especially with the illicit counterfeit pills that are being made, and that is definitely targeting and really being impacted by our youth, especially the mental health piece as well. So there's a lot of different factors. And honestly, we could probably do a completely separate presentation just on this topic alone.
Data. Yep.
But definitely great question. But certainly reach out to us, and we could, as Becky mentioned, try to provide some more of the data. We just don't have it right here.
Right. Well, just not really any more questions, but just lots and lots of positive comments. People saying excellent program, thanks for the assistance, especially for those who could not otherwise afford any type of assistance. Seems your program is state of the art. Yeah, so just super comprehensive program, just lots of people saying positive things. But I just want to thank you guys. This was really interesting for me, and it was great to meet you, and we'd love to have you back if you would have another presentation at some point.
Oh, absolutely.
Okay.
We would love to. It's really been an honor and a privilege. And of course, please reach out to us. We'll be glad to provide resources or point you in the right direction.
For sure.
Great, fantastic.
And someone had
Oh,
can
go
I
ahead.
interrupt 1 second?
Sorry.
Someone had
Yeah.
asked about the fentanyl test strip supplier. We used BTNX, all caps. BTNX is our supplier. In case someone would like to check that out.
Okay, yeah, I'm sorry I missed that question. All right, well, if attendees don't mind sticking around for just a minute, I'm going to go over some housekeeping items and about how to get your certificates. Thank you so much again to Becky, Libby, and Natalie for this wonderful presentation. Thank you everyone for great questions, and thank you for your participation. We would like to remind all participants that a PDF of today's PowerPoint, along with the recording of today's presentation, will be uploaded to our webinar library located on IRETA's website sometime within the next week. Once we have these resources posted, a link will be sent to all of today's registrants. I now want to remind you of our evaluation and CEU process. You will receive several follow-up emails from us. The first email will include a link to the evaluation, and the same email will include a step-by-step instructions on how to obtain your CEUs. Please note that it will take up to 48 hours for your CEUs to become available because we have to cross-check your attendance records with WebEx. We would like to specially request that you fill out our evaluation. It should take no more than 2 minutes of your time. Again, we want to thank everyone for taking time out of your day to participate. If you have any questions at all, please email us. The email address is info@ireta.org. And with that, I will conclude the webinar. Thank you so much, everyone, and have a wonderful day.
Yes. Thank you so
Thanks.
much for having us. Have a wonderful
Yes,
day.
thank you.
Thank
Bye.
you.
Thank you. Bye.
Bye-bye.